This is your doctor. They attended medical school to learn all about the human body and how to heal it. It is their job to take what they learn and use it to treat their patients. They also need to teach their patients about their care they're getting. Because they have all this information, it's their job to explain it to the patient who didn't go to medical school. Unfortunately, not all doctors do a good job of doing this, leading to a gap in the patient's knowledge, the doctor-patient knowledge gap. Why is filling this gap so important? Well, to understand that, we need to talk about informed consent. Informed consent is defined as the process by which a patient learns about and understands the purpose, benefits, and potential risks of a medical or surgical intervention, including clinical trials, and then agrees to receive the treatment or participate in the trial. Basically, the patient needs to understand what's happening to them.
To better understand the idea of informed consent and why it is important that doctors explain things to their patients, look at the example of a patient needing to get major surgery. The doctor tells the patients that they are fixing a hole in their stomach. That's it. The patient agrees to get the surgery without the doctor explaining anything else. None of the side effects, not what the recovery is going to look like, nothing. They get the surgery and wake up with over 20 stitches in their stomach. And then they find out that they cannot lift anything over 5 pounds for the first few weeks. One problem: the patient has a toddler and does not have anyone to care for their child now. Because the doctor did not fully explain the surgery to the patient, they were not able to fill this knowledge gap that the patient didn't know about the surgery. Because of this, the patient agreed to something they did not fully understand the risks of, which is not true consent. Now that we understand what the knowledge gap is and why it's an issue, how can we fix this? Well, there's a couple of different ideas. According to an article by Rallius Media, the biggest thing would be a new approach to ethics in medical school and medical education, including small group activities and case-based learning, ethical shadowing and examples, and patient simulations. Additionally, communication classes in medical school could also go a long way. The issue also just needs to be talked about. If we do all of these things, we have a great chance at closing this knowledge gap.